We have a fantastic opportunity over the next few minutes to talk about bladder cancer awareness, education for patients. Elizabeth, you're at the forefront dealing with patients as a medical oncologist, and Jean, I know you work with Elizabeth educating patients and caregivers about different treatment options. And I'm delighted to have you on the set, Stephanie, to talk about the Bladder Cancer Advocacy Network and how that can be a helpful resource, not just for patients and caregivers, but also for clinicians in the field.
Absolutely.
Managing patients with bladder cancer. Welcome back to Cure Connections, and thank you for the input on this segment. Stephanie, let's just kick off by hearing a bit more about what is the Bladder Cancer Advocacy Network, who's it there for, when was it formed, and what's the role of the network?
Absolutely. We started in 2005. A wonderful woman named Diane Qualley and her husband John began the organization when they got really frustrated that there was nothing specific to bladder cancer out there. They had a conversation with John's doctor, because John had been a bladder cancer patient since 2000. And he said, if you want to start it, let's get going. And they went right off to the American Urological Association meeting, where it was incredibly well received, and they started with their first scientific advisory board back in 2005. They had 18 people involved, and John sadly passed away from bladder cancer in 2008. But right now I can say we've got 64 people on our scientific advisory board, and we're very thrilled that Betsy Plimick is part of that process.
I mean, that's an incredible story that a patient took his own diagnosis to set up and establish 18 physicians, did you say, in the beginning?
Yeah.
That's really quite astounding.
And it really was predominantly urologic. And now we really do have among our close advisors, medical oncologists, pathologists, radiation oncologists, social scientists, and then of course we bring the voice of the patient to them as well, so they have a better sense of that lived experience of having bladder cancer.
So the network is there predominantly for patients and to bring together experts in the field with their knowledge, not just of treating cancer at the coalface and clinicians, but also you've mentioned research and scientists and pathologists, which is where it all starts, yes?
Right. We really have the classic nonprofit three-pronged advocacy, research, and education. And in the research area, we actually provide medical research grants to scientists to develop new treatments. Obviously, our goal is to make the lives of patients better by having more options in the tools in the toolbox. And then we do provide patient support, we do patient education, and then of course when there are issues, which there always are, we advocate on behalf of bladder cancer patients on the Hill and even on a state level. And raising awareness is the most important thing. We want to make sure that all patients don't learn about bladder cancer at the time of diagnosis, because particularly if you fall outside of the realm of the average age group and you're not a smoker where there's some known risk factors, people don't always look for bladder cancer. And I think a lot of younger people, a lot of people that don't have risk factors are often treated for other things first. And I hear many, many stories from patients about that.
That's right. Now, 2005, when the network was first established, in the grand scheme of where we've come from then to now in the treatment options available, it's a million years ago. It must be very difficult to keep up with all the advances in the treatments to make sure that the network is accurate and up to date. And you obviously have a great panel of experts helping you. I think that's one of the big problems for patients, isn't it? That the information that's out there so widely available on the internet and blogs is not always accurate or up to date.
And not always focused on bladder cancer. Oftentimes they'll look and they'll find things that are focused on cancer, but not specifically the nuances that are involved in bladder cancer, the high rates of recurrence, the very invasive monitoring that goes on. Those are all things that are unique to bladder cancer.
Now, you've mentioned obviously about the value of awareness and how at diagnosis that may be too late to be educating patients, but how do you encourage people to be proactive about educating themselves about a disease that they don't have or they don't know they have? I mean, how do we bring that into patient awareness before diagnosis?
Well, I think for a lot of people, just understanding the signs and symptoms, like the hematuria. So many people, particularly women, might be treated for other things. They're treated for urinary tract infections, or even with urgency and frequency, as you heard earlier with Michael. Those are things that people will just assume that it's something other than bladder cancer if people fall outside of the range of the typical patient.
Right.
So being in their 60s or 70s, and people who are smokers. So if you have no known risk factors and you're having these other symptoms, it's always better to get checked if you have this question. You don't know until you've actually had an expert take a look.
And I totally agree, but here's being devil's advocate. If you're a patient, you go to your doctor, you've had blood in the urine, you say, look, I'm concerned, and even if you are aware that this may be a risk factor, and the doctor says, oh, don't worry, you've just got a urine infection, do you have a role in the Bladder Cancer Advocacy Network about educating doctors that are at the forefront of this to say, because many patients go with all the right symptoms, they give the perfect history,
right.
They have the obvious risk factor, they've been a heavy smoker for many years, and sometimes they even raise the question. But once or twice a year, I see a patient who's been told they've had recurrent urinary tract infections, particularly women where it's much more common, and unfortunately there's a delayed referral to a urologist, there's a delayed diagnosis, and actually the patient's done everything they possibly could and they put their trust in their primary care doctor. Do we need to be educating primary care doctors more about this? Do you have a role in that, or is it more for patient education?
We do try to reach out to make people aware. First of all, we make patients aware that they need to stand up for themselves and they need to question if they're getting treated for urinary tract infection that doesn't seem to go away, and we start to plant the seeds that, could this be something else? Could this be bladder cancer? They need to be able to stand up for themselves. But yes, we really try to educate the general practitioners in the world, the OBGYNs that might be a woman's primary doctor, to say, take a look. If it doesn't go away, then maybe there is something deeper, something bigger that needs to be looked at.